Well, we're now going to look at whether, if we had locked down just a week earlier, thousands of lives might have been saved. In the crucial 2 weeks before lockdown, Boris Johnson's government has been accused of dithering and having a flirtation with so-called herd immunity. Looking back, how on earth did we allow this to happen?
Abracadabra into pressure the closing stages. Shishkin being lifted out the far side by Nicola Boyville. It's very tight between them.
That was Cheltenham Festival. And there was this.
Oxlade-Chamberlain on the move, delivers the cross. Wijnaldum! It's in! Jorginho Wijnaldum for Liverpool in the Champions League again!
So did we lock down too late? Here's Jonathan Calvert, editor of the Insight Investigation team at the Sunday Times.
Undoubtedly. I don't think there's any doubt that a quicker lockdown would have saved many, many, many lives.
And let's hear from the BBC Radio 4 programme More or Less, who have compared the British approach to lockdown with that in Germany.
They locked down after 86 reported deaths, and we locked down after 359 reported deaths. And the Germans then carried that lower death toll all the way through.
So even though we didn't have the testing capacity of Germany, we could have limited the death toll to German levels if we'd locked down earlier?
According to the modelling work of long-term friend of More or Less scientist James Annan, if the UK had gone into lockdown a week earlier, we would have seen only a quarter of the reported COVID deaths that we've had, about the same as in Germany.
Yes, you heard that correctly. A scientist saying that instead of 36,000 dying, it would have been 9,000 deaths instead, similar to German levels. So forget Dominic Cummings driving to Durham. Perhaps this is the most damning accusation any government can face. By delaying lockdown, perhaps tens of thousands of British citizens died needlessly. You can email us on vine@bbc.co.uk and don't forget to include your phone number so we can call you back, or you can text 88291. Jonathan Calvert is here. But first of all, let me talk to Dr. James Annan from Blue Skies Research. Good afternoon to you.
Good afternoon.
So you're very specific about the number of lives that might have been saved if the country had gone into lockdown just 1 week earlier. How many lives do you say would have been saved, and how do you arrive at that figure?
Well, the estimate is that we could have reduced the death toll by about 3/4. And it's really a rather simple calculation based on the fact that the epidemic was doubling in size about every 3 days or so at that time. So by stopping the rise a week earlier, it would have been a quarter as big, and that would have just meant a quarter as many deaths.
And is this something that you are saying now with the benefit of hindsight, which always makes everything crystal clear? Or is this something that you feel you could have imparted then? Could you have imparted a sense of absolute urgency then and said, now look, with every hour that you delay, this is the number of people dying. With every day, it's this number. Hurry up.
Oh, yes, very much so. I mean, a number of us were saying things like that back then. It's a very simple calculation that all the epidemiologists advising the government knew, and it was clear by the middle of March that we had no choice but to suppress the epidemic, and that any delay was going to lead to a greatly increased death toll.
We said just earlier there was what might have amounted to a kind of brief flirtation with the idea of herd immunity. Was that a factor? Was that part of the reason for the delay and the dither, if there was delay and dither?
I would think initially it probably was, yes. But even by the middle of March, it was very clear that that was no longer a viable strategy. So it's really the extra week, even from when they agreed that suppression was the only choice, there then was another week lost at that point between, say, the 14th or the 16th of March up to the 23rd.
And when you
the
say
government actually brought in the lockdown.
Epidemiologists could have said that, knew that, were convinced of that then, were you shouting it from the rooftops? Were you rattling on the doors of government to say this or not? I mean, did they ignore advice or were they not given that advice?
Well, I don't know exactly what advice they were given. I was certainly saying it in public at that time, and many other people were too.
Well, thank you very much indeed, Dr. James Annan there from Blue Skies Research. Let's talk to Jonathan Calvert, editor of the Sunday Times Insight Investigative Team. I mean, Jonathan, these are such extraordinary statistics. If we'd locked down 1 week earlier, tens of thousands of lives would have been saved, you say. Tell me how you came upon this kind of idea and how you've substantiated it.
Well, I mean, there's some recent research has been done by Imperial College, who are the government's own modelers and Oxford University, which has looked at those. Basically, it's taken the numbers of deaths and the dates of the deaths and then back-modelled them. So it's probably the most accurate study so far on the history of the virus as it swept through the UK. And that showed us, just as your previous expert said, that the virus was doubling every 3 days, which meant that, when it's a small number, 4 to 8, 8 to 16, it's not much. But by that very middle week in March, the crucial week when the government seems to have decided that suppression is necessary, but then dithers for another 9 days until lockdown, there was something like 200,000 infections. And because it doubles every 3 days, by the time they went into lockdown, it was 1.5 million. And now that the Imperial study has looked at 11 different nations across Europe. And at the time we went into lockdown, we had a much higher number of infections than any of those other countries. Germany, for example, locked down 2 days before us, so it's quite late. But it only had about 280,000 infections compared to our 1.5 million. And I think when you look at it that way, you can start to understand why we have the second highest number of deaths in the world, etc., and why it's taking us so long to get out of the lockdown.
Were you party to any of the reasons behind what has been described as dithering and delay? What was the prevarication about? Why didn't they just say OK and do it?
Well, we looked at, because we did the first kind of period between January and late February in which the UK was failing to really understand that this was serious and wasn't preparing in terms of PPE and testing. And then with this last article, we looked at the 3 weeks in March. And what was quite clear is at the beginning of March, the government were told quite clearly that its strategy wasn't going to work. So basically, the scientists told them at the beginning of March that if you didn't do anything at all, 500,000 people would die. If you brought in mitigations, i.e., working from home, closing down schools, social distancing, that sort of thing, then that would work up to a point, but not great because it would still be 200,000 deaths. So, but the government, nonetheless, for those first 2 weeks of March, went ahead delaying, bringing in any measures. And in effect, what they were doing is the wider policy was quite simple. They were allowing the disease to spread, and at some point in the future, they were going to shield the elderly and those who are ill from the disease by giving them kind of severe social distancing. And if at any point it looked like their curve was getting to the stage where it would overwhelm the NHS, then in that case, they were bringing one of the new measures. And it's quite noticeable if you go back through the press conferences of those days, they're always talking about bringing in measures, but not bringing them in for several days. And so they didn't really bring any real proper measures in at all in those first 2 weeks, apart from, which is kind of the obvious one, of telling people who actually have the symptoms to stay at home for 7 days. And that was the only one they brought in 2 weeks.
And again, I would say why? I mean, if they could see, as you say, the spread exponentially, the doubling, and the figures were very clear. You say it's not difficult maths; it's very easy maths that anyone can understand. Why did they do it? Was it to do with some kind of ideological affiliation to libertarianism that meant that they just didn't think that they could impose this, or they didn't think that we would comply, or what was going on?
I think there was an element of both. That they had a look, but I think there was also a big fear around the corner, which is that there was this theory that if you suppressed immediately and absolutely kind of wiped out the number of cases, then all you were doing was kind of stopping it for another infection that might come up in the autumn.
And is that valid, that fear?
Well, it could be valid, except that the problem with that is that they've created a worse situation by allowing it to develop to the stage where we got 1.5 million cases. So what happened in the second week, and one of the key reasons they changed their mind, was their own modelers took it upon themselves to model what would happen with a lockdown. And they showed that with a series of lockdowns, you could get the number of deaths down to around about 30,000.
Jonathan, thank you very much indeed for this. Jonathan Calvert, their editor of the Sunday Times Insight Investigative Team, with that extraordinary research, taking your calls on that.